This is an IV initiation video. Supplies are gathered, which include an IV catheter. We're using a 24 gauge for the purpose of this video. The expiration date has been verified. We are using a J-loop, sterile normal saline syringe, non-allergenic tape, which has already been pulled and placed on the table, clean gloves, tourniquet, chlorhexidine wipes, TSM dressing, which is labeled with the date, time of insertion, type, gauge, and length of catheter used, and the nurse's initial. We also have a towel or bed protector. The nurse would then introduce herself to the client and verifies the client using 2 forms of identification.
Hi, my name is Jennifer. I'm going to be your nurse today, and we're going to do an IV start. Can you tell me your name and date of birth, please?
Joe Shady, 4/8/84.
Thank you.
The nurse would then assess baseline vital signs, which is not shown on this video, would assess allergy to latex, tape, or iodine.
Do you have any allergies to latex, tape, or iodine?
I do not.
Thank you.
Any bleeding tendencies the patient might have.
Do you have any bleeding tendencies, or are you on any blood thinners?
No.
Okay.
Any diseases or injuries to the extremities.
I'm going to be starting an IV here on your right arm. Do you have any disease or injuries to this arm? Okay, thank you.
During this ID process, the nurse's assistant cleaned and set up the preparation supplies. Next, the nurse would perform hand hygiene and select the venipuncture site. The nurse's assistant could open supplies while maintaining their sterility in the packaging. To dilate the vein, there are several options. The arm can be placed in a dependent position to allow gravity to dilate the vein, which our patient has already been doing. Next, the nurse will use a tourniquet to help dilate the vein. If the person has hypertension, the tourniquet would be higher on the arm. For a patient with hypotension, the tourniquet would be lower on the arm. Other possible ways to dilate the vein would be to massage or stroke the vein distal to the site, encourage the client to clench and unclench the fist, lightly tap the vein with the fingertips to dilate the vein, or wrap the extremity in a warm towel to use heat to dilate the vein. As you can see, the nurse is putting on clean gloves. She will then apply the tourniquet, select the IV site, clean it, and we will go from there.
Okay. Looks like good spot.
She needs to scrub the area for 30 seconds. And then it needs to be allowed to dry completely. And we'll have to use the chlorhexidine to make sure we get all of the antimicrobial characteristics. Again, she's scrubbing for 30 seconds.
Okay, I'm going to let that dry for a second. It's ready. Okay.
With her non-dominant hand, she's going to pull the skin taut to make sure and stabilize the vein. Hold the catheter at a 15 to 30 degree angle with the bevel up. Insert catheter through the skin into the vein. Once blood appears in the lumen or flashback chamber, lower the angle of the catheter until it is almost parallel. Release the tourniquet, put pressure.
Alright, so I would put this in, and then we would flush with normal saline into the J tubing, and then you would apply the Tegaderm to this, and then we would tape it down, and then we would finish. And this would be initialed as well. Did we not get anything to?
Use an alcohol pad.
I'll just use an alcohol,
Please.
a new one.
Am I done now?
Yeah,
Yep.
make sure